What are the best available treatments for fine lines under the eyes? A lot of my patients come into my office and they don't realize that one of the key things that they're doing that they shouldn't be doing is they're rubbing their eyes. So they're really assaulting their eyelid tissue. And the eyes are the thinnest skin of your body. If you're a woman like me and you're taking off your makeup at night, you need to take it off really lightly, like a feather, where you're not scrubbing and rubbing, like you're scrubbing or rubbing at a pot, because then your eyes will actually look like a pot. So I tell my patients very lightly remove your eye makeup. If you have allergies, take Claritin, take Zyrtec. Take one of those antihistamines so you're not itchy and you're not miserable. But one of the key ways to treat fine lines is to not develop them to begin with and stop rubbing your eyes so much. I tell a lot of my patients when they come home from work to take off their eye makeup and just put ice on their eyes for 2 to 3 minutes, because it'll calm down the inflammation and it'll help in terms of the itching significantly. And so my patients love that, and they love the idea of using something that's inexpensive. Additionally, for fine lines, there's all kinds of topical cosmeceuticals that help significantly, that have science behind them. And that's what's critical. They have to have science behind them in order for them to work properly. And then after that, different things at the dermatology office. For example, I'll pop a little bit of Botox, like 1 or 2 units right under the eye, right here, and that can help some with fine lines. For my patients that have more significant lining under their eyes, perhaps I'm doing the Fraxel, which is a non-ablative fractional resurfacing machine, all over their face, including extra under their eyes for their fine lines under their eyes. Other things would include getting some sleep, because if you don't sleep and you're dehydrated, the thinnest skin of your body is going to show that more. And then finally, I tell my patients, if you're really upset by now not fine lines, but hollows under your eyes, then there are many dermatologists, myself included, that actually do filler under the eyes to make your eyelid area flat so it's not sunken in anymore, so you don't have that hollowed out kind of always tired look. So in terms of precautions treating under the eyes, the doctor needs to be a board-certified dermatologist or plastic surgeon that knows what they're doing, that's comfortable with the under-eye area. I've actually done clinical trials in this area. I'm very comfortable filling under the eyes, and I actually can stand in the mirror and fill under my own eyes, so I can certainly do it to a patient. But there are products that are way too dangerous to use around the eyes, and those would be any of the permanent fillers. I would not advise you use, and I would not advise that you use something that's caustic to the eye, to the cornea at all. You really have to make sure that you don't just buy anything off the internet, that you check with your dermatologist and you see what you should and you shouldn't use for your skin type, for your level of aging, and for what you want and need. And then finally, I would say in terms of fine lines under the eyes, that you want to just think about what your habits are. Are you exercising? If you exercise a minimum of 4 days a week, you're going to boost your circulation. If you're boosting your circulation, then your blood's going to flow throughout your body better, and it's also going to flow to your eyes better. And what that means is that you're providing an oxidative benefit by exercising that helps to decrease some of your fine lines and wrinkles. It helps to boost your circulation, your skin glows, and your eyes almost look like they're glowing after exercise. Even if you hadn't had a good night's sleep, you can still play it off like that. Not that I recommend not having good night's sleep, but that's what I've had to do sometimes. So in terms of an effective skincare routine, I would say anti-aging treatments that decrease fine lines and wrinkles around your eyes, that are safe to use around your eyes. Definitely a hypoallergenic fragrance-free sunscreen that goes right up to your eyelid verge. And then I love the in-office procedures that I offer, like a little bit of Botox under the eyes, or the Fraxel, or perhaps a little filler under the eyes. So definitely it would be a combination of both things that would bring the benefit of you looking a bit younger and a bit fresher